This case is going to be unique. In fact, it's so unique, most of you haven't even seen one remotely like it before. So stick around, find out what it is. Welcome to the Hair Transplant Mentor YouTube channel. My name is Joe Tillman, and if you don't know what a hair transplant mentor is, you can learn all about it at hairtransplantmentor.com. Welcome to Hair Transplant Consultations, Episode 3. Right, so before we get into that, I got a few things to talk about first. The first thing is thank you so much for everyone that's been sending in your consultation requests ever since I did Episode 1 a couple weeks ago. I've been getting flooded with a lot of requests for consultations, so thank you. I'm not going to be able to get to all of them because there's so many, and I didn't expect to be able to do everyone to begin with because these take a lot of time to do, but I will get to everyone that I can, and again, thank you for your submissions. Second thing, and this is really important, I am not a doctor. I've been in the industry for 18 years. I've conducted tens of thousands of consultations at a very high level, and I know what I'm doing, but I'm not a doctor. In fact, if you construe this as medical advice, then you're being an idiot because I'm sitting here telling you, or standing here telling you, that I'm not a doctor and this is not medical advice. So this isn't medical advice, and don't think of it as such. So last thing before we get into the case, GrowMD shampoo. I've been mentioning it in every video because it's a pretty cool contest, at least I think so. 3 lucky winners will get a year's supply of GrowMD shampoo. And GrowMD shampoo, like it's a hair loss shampoo, but I don't use it for that because I really wouldn't be able to tell if it's working for me because all my hair is transplanted. But what I can tell you is it's a good shampoo. Like, I like the way it makes my hair feel, my scalp. I know it's a good clean shampoo. It doesn't have SLS or parabens, which are bad to have in shampoos. And I know the owner, I know the formulator. His name is Dr. Amir Yazdan of Modena Hair Institute down in Beverly Hills. And he contacted me earlier last year and asked me if I wanted to try it. He wanted my opinion on it. And so I've been trying it and I've been using it and I really like it. So yeah, great idea for a contest. 3 lucky winners. All you got to do is make sure, 1, you're subscribed, 2, you click the bell to get all notifications so you get notified about the video where I'm saying you won a year's supply of GrowMD shampoo. And number 3, you got to comment down below in the comment section. Not just this video, any video, because the more times that you comment, the more entries that you have in the contest, which means you got a higher likelihood of winning. And so, yeah, sure, enter down in this video, but go ahead and comment in the other videos. It's fine, not a problem. Do it! My light isn't so good here, so back to the video. Right, so the case. What's so unique and interesting about it? Well, let's just let the pictures do the talking. Traction alopecia. Well, you might be asking yourself, what's so unique about this? It looks like some guy with, kind of like Norwood 3A pattern hair loss, and you'd be right. I mean, it's kind of like a Norwood 3A. But I'll show you the other pictures here in just a minute. But before we do, I'm going to read some comments by the patient before we get started. Right, so he starts off with, "Hey, I'm a Sikh male, age 23, Sikh being the Sikh religion, and I've suffered from traction alopecia. It's extremely common amongst the community, but the content and information out there regarding this specific issue is extremely rare. You've been in the field for quite some time, so I'd assume you've come across it, but I will give you some background to the case anyway. I have seen a lot of these cases because I've had a lot of Sikh males come in to the local office where I used to work. So yeah, I've seen this quite a bit, and I've had a lot of cases submitted to me online over the past several years. But back to his email. Yeah, so in case you haven't seen this before, Sikh males keep their hair long and typically keep the hair in a bun, which tends to be tied on the top of the frontal hairline area. Due to the repetitive style and tight keeping of this bun, the hairs being pulled in that area are damaged quite badly. He says here, reason I contact you is because there's literally nothing of any depth out there on the issue, and I know many friends and relatives who have suffered the same problem. Now, with the extent it gets to after childhood and teenage years, it gets to a point where there is nothing that can be done to repair the areas damaged apart from surgical intervention." He's correct. "I had a consultation with a trichologist And we were in agreement to look to pass this on to the doctor. And he goes on to talk about the doctor, which is, again, another doctor that I work with. I don't have male pattern baldness, and it's just traction alopecia, but I know for younger people, surgery at such a prestigious clinic would only be carried out in exceptional circumstances. He's talking about his age here. He's 23, which I would believe mine to be. What sort of hairline would you look to create on me? What would be a sensible one and realistic one that the doctor may suggest? If you could just draw one on here, but keep my personal details and face anonymous, blur my face, etc., please. Some more details about my case. My current state has been the same. Okay, so, all right, that's the basics of it. He's been to a trichologist who examined his hair and gave him some input on what his situation is. It was mainly just affirming what he already knew, which is it's traction alopecia. But there's a note in the assessment that he sent me. He gave me the assessment from the trichologist that I'm going to address later on. So you've seen this. Let's look at the sides. And this is the telltale sign of traction alopecia. I've seen this on just one side on a lot of patients, but I've also seen it like this case where it's both sides. And you can even see the demarcation of the line on his forehead. That's a tan line because Sikh males wear their turban very low above their eyebrows, or at least the ones I've seen. And so that's why you see that line. It's just a tan line. Now, before I continue with the photo showing you his case, one problem I ran into is that his photos are showing his hair without separating it. So I can't see his donor area. Like this is his donor photo, which would have been okay. Like the lighting is too low, but besides that, his hair is just really long. It's going down the back, and he's not separating it. And I know it would be really difficult in this case, so I have to use some baseline assumptions on this case. But then when we also look at the top, again, the hair is going back, and it's really long, so I can't really see through the top. Like he's not separating it, so I can't really see the top if there's any sort of actual male pattern baldness going on besides the traction alopecia. Now, the patient said that there's not, but I can't take his word for it. Like, this is what I do. So a lot of times patients will say, I don't have this or I don't have that, and I look at the photos, I'm like, yeah, you do. So in this case, it's more difficult because the hair is so long and it's covering the areas that I want to look at. But I can still see some things that I'll get to in just a moment. And before I do, I want to read the report from the trichologist themselves. Right, so chronic Tillman effluvium, seborrheic dermatitis, and possible androgenic alopecia or male pattern hair loss. Now, this is interesting because he's saying he doesn't have it. Moving on, then scalp microscopic viewing showed some hair miniaturization. However, this can be due to ongoing Tillman effluvium. And I would like to see your blood test and monitor your hair before confirming or recommending treatment. Okay, so pretty basic. But what I'm seeing is something that does indicate male pattern hair loss. Check it out. You can see like the traction alopecia is pretty bad. Like the entire area above the sideburn, the temple point is obliterated. And then when we look on the other side, you can see that it's the same deal. Like you can see some little hairs in the traction zone, I'll call it, but those are just barely hanging on. When we look back into the mid-scalp region from the side, I'm seeing that it's almost like a thin spot here that I wouldn't normally expect to find on someone that doesn't have any sort of androgenetic alopecia. While this isn't measured, this isn't scientific, my gut tells me, just based on knowing what I'm looking at, or looking at thousands of photos over the years, that I think that this is an indicator that his hair might be affected, at least in some degree, a small degree maybe, by DHT, and these hairs are susceptible. And when I look at the overhead shot, again, there's no rhyme or reason to this. It's just what I think I'm seeing. Right here in this kind of behind the temple region, his left temple region, This looks a little thin as well. So I don't see it in the original frontal photo. So it's really hard for me to gauge this. But because the trichologist said that they see potential miniaturization, that tells me that, yeah, there could be some alopecia going on here. So I would recommend that there be medication involved with this. But here's the problem. This is not a normal case as far as, looking like the guy has male pattern hair loss. The sides are the dead giveaway, and I'm sure that this would be embarrassing for him out in the field, on the dating scene, and just going through his everyday life. In fact, he does go on to talk about how it's affected him. I'll read some of that. He says, "It's really imperative that I do have a surgery, as I'm forced to hide my hair constantly and I don't feel comfortable or free at the moment at all. It's been a deeply stressful and hard time for a number of years, but I really feel that now is the best time to have it done, as I can't carry on the way I am. It really takes its toll, and I truly believe it would be very successful, especially with Dr. So-and-so carrying out my procedure." Another hard luck story, another heartbreaking story of how hair loss affects all of us. So yeah, man, I know you're not the only one, but I know you feel like the only one. First off, before you do anything, you do have to get on the medication. I'm sorry, you gotta at least give it a shot, because if the trichologist says that there's miniaturization and then the doctor says that there's miniaturization and he believes that there is male pattern hair loss at play here, then yeah, you need to give it a shot, because you're 23 and dealing with your existing issue is not going to take just a few grafts. It's going to be a big procedure, and you probably need to have 2 passes just to get the proper density to blend in with the rest of your hair. But you did also ask me if I could draw a hairline to give you an idea of what maybe the doctor will be telling you to expect. Let's give it a shot. I did what I think is a reasonable approximation of what you should expect. Not too low on the hairline, not too aggressive on the temples and the temple points, but it certainly restores you to a look of normalcy. This could be something that is suggested. The doctor that you're talking to or that you're considering, he doesn't like to be really aggressive as far as design. Whatever he does, it is a natural appearance every time. And so I think that, yeah, it'll probably be something like this. We can look at the other side and that looks like it'll work out well. This is just a rough approximation, hairline height, all that. Right, so I think that, that's the general idea of what you can expect. And because, I don't think I said this earlier, because the patient is talking about FUT, strip surgery, I think that's a great way to go, especially because he's not gonna be shaving his head anytime soon. Like, this is his deal, long hair for life. So yeah, FUE, not happening. But yeah, I think your options, like obviously medical intervention, look at finasteride, look at oral minoxidil, look at mesotherapy, look at non-surgical alternatives like PRP, things like that. But in my view, you can start with, in this case, you can start with the basics, finasteride, and give that 6 months, because you're not in a huge rush. Like, you want to get it done, but you said this year, you didn't say like ASAP. So give it at least 6 months. See what it does for your hair based on what the doctor says about your baseline, like where you're starting before you begin the medication, and give that 6 months, see if that works out for you. And then you can consider surgery and maybe consider some sort of hairline design like I drew here, or whatever the doctor suggests as well. But I think that it's in your best interest to examine and seriously consider moving forward with this in 2 steps as opposed to 1. That way you can better gauge the overall reconstruction, and you can still wear that do-rag or wear that bandana to cover everything up, just as you are today. And I think that that's probably the best route to go. And then once it all grows out, you can go back in, the doctor and you can assess on the next best step and tweak things here and there. and add more density so that the final result blends in nicely with everything you got. You're not in a position to risk this because, I mean, yeah, you can continue to hide bad work or poor growth with your head covering, but you don't want to do that. Like, if you could do that, then why get surgery, right? And you just got to keep in mind that nothing is guaranteed. This is an elective surgery. It is a risk. So never forget that, any of you that are watching this, and of course, the patient. That's it for hair transplant consultations number 3. This video is done. Thanks for watching. Peace.